We have a very special guest with us today. It's my distinct honor to introduce someone who has long stood as a champion for improved kidney patient health, increased organ donation and access to the right medicine at the right time. Congressman Jerrold Nadler is not only a distinguished member of the United States House of Representatives, representing New York's 12th District, but he's also a longtime friend and ally to AAKP and to all the people and families impacted by kidney disease. Congressman Nadler has been a steadfast advocate for living organ donors and increased opportunities for organ donation. His leadership and commitment to listening to patient and organ donor concerns have positively impacted national policy. As a champion for the bipartisan 2025 Living Donor Protection Act, he is helping ensure that those who give the gift of life are not penalized by their generosity. Please join me in welcoming Congressman Jerrold Nadler as he joins us live from Capitol Hill. Welcome, Congressman Nadler, and I appreciate you taking the time out of your schedule to join us today and have a conversation about the Living Donor Protection Act.
Sure, thank you.
So in regard to the LDPA, this legislation is a rare gem in the current environment in terms of bipartisan support. Can you tell us a little bit of background on the bill and how you came to become a champion for the protection of living organ donors?
Sure, but first off, let me thank you for having me and for this opportunity to speak at this policy summit. 8 or 9 years ago, a member of my staff had a baby born in kidney failure. She donated her kidney to him, but she told me about the roadblocks she faced in making the selfless decision to save her son's life. I originally introduced this bill in the 113th Congress in 2014. The bill does three things. It prevents long-term care disability and life insurance companies from discriminating against living organ donors. It allows organ donors to access family and medical leave to recover from surgeries, and it directs the Department of Health and Human Services to update their materials on live organ donation. I introduced this bill because we must lower roadblocks to organ donation. There are over 100,000 Americans on the organ donation wait list, and 13 people die every day while waiting for a donation. If we had better laws in this, we might have more organs to donate and fewer people would die. Many donors cannot get the time off to recover from donating an organ because their employers consider the procedure elective and not eligible for time off under the Family Medical Leave Act. A quarter of donors have reported problems accessing insurance because of their status as an organ donor, even though organ donors tend to be healthier than the average American. People shouldn't face these roadblocks when trying to save a life by donating an organ. That's why I introduced this bill.
That's wonderful. Can you tell us where, at the end of the last session, the LDP ended up, and was there anything about last year's experience that was different for the bill in terms of stakeholder legislative support?
We ended the last Congress with 225 bipartisan co-sponsors in the House, more than we've ever had before. And remember, 218 is a majority. That strong support was because of the passionate grassroots lobbying from advocates like all of you. Additionally, we gained the support of the insurance industry last year, which is a major step. This led to many more Republicans on the Financial Services Committee supporting the bill. The bill gained so much bipartisan support last Congress that House leadership considered including the bill in an end-of-year package, and the Senate side considered moving the bill in committee. However, we weren't quite able to make it over the finish line last year. We're hopeful that this year is the year we can pass the bill, finally.
Me too. Strategically, how has the approach for advancing the legislation changed this Congress, and is there still bipartisan support for the bill?
Yes, there is bipartisan support. It's easy to get bipartisan support for good legislation that both saves lives and saves money. And that's exactly what this bill does. The Living Donor Protection Act is more bipartisan than ever before. One of our strategy changes is emphasizing just how bipartisan this bill is. In fact, Representative Bacon, a Republican, will lead the bill in the House this Congress. I will also support the bill as the co-lead. On the Senate side, the bill is also led by a bipartisan pair, Senator Cotton and Senator Gillibrand. Many members from both sides of the aisle have confirmed they will support the bill again.
That's wonderful news. And then one final question for you. After this policy summit, AAKP is kicking off a summer campaign called All Kidney Policy is Local, encouraging grassroots AAKP members and allies to visit their local congressional and Senate offices over the summer break to communicate their support for organ donation and kidney care innovations. What message should patients and allies share about the bill to their congressional leaders and senators?
Well, the advice I give is the advice I give to advocates for anything. Talk to the people who represent you in Congress, your senators, your members of the House, and tell them your personal stories about why we need to lower roadblocks to organ donation. When you share your stories with representatives and how the legislation can improve your life, you help build interest and support in the bill. We know that organ donation saves lives, which should be reason enough to support the bill. What many people don't know is that organ donation also saves money. It cuts healthcare costs by as much as 2/3 by eliminating the need for many long-term treatments for chronic illnesses. This bill also has the support of a wide range of stakeholder groups, including, of course, the passionate folks at AAKP. Here's the bottom line. We must lower these roadblocks to organ donation so we can save lives. The Living Donor Protection Act is bipartisan, cost neutral, effective legislation, will save money, and will get the job done.
Thank you, Congressman. We'll certainly carry that message. And thank you for sharing your insights and for your steadfast support of kidney health initiatives and living donors. Your voice today has inspired all of us, advocates, patients, care partners, and fellow policymakers, to continue this vital work. And on behalf of everyone here, thank you for your dedication, your compassion, and your unwavering commitment.
Well, thank you, and hopefully we'll get across the finish line this year.
That's my hope as well. Thank you, Congressman.